Good evening. This is Dr. Harlan Fuhr, Chairman of Activator Methods, and the program is Hot Topics. And Hot Topics it is from Phoenix, Arizona, because it hit 100 today in Phoenix. And you know, we bragged all winter about our nice weather, so now you guys in the north can brag about your summer. But tonight's topic is new patients, and this is going to be a real short section because there's so many things that we're going to cover in it, but it's just 16 slides, and you can just go to your bar down at the bottom where it says chat, and the chat bar, you can ask questions. It's called question and answers. You can see Q&A up there, and you're welcome to ask as we go along here. I'll stop and answer any questions you might have. Now, when I was in full-time practice, and I started actually 4 different practices and used the same model on all 4 practices. I had Redwood Falls, Minnesota. We saw up to 1,000 patients a week there. Then we split that practice and took half of it to Wilmer, Minnesota. And those 2 practices got up to 5,500 patients per month. And then from there to Arizona, it was a different marketplace. And we got up to about 300 patients, but we were more busy and activated, and I didn't have the time to put into getting new patients. The 1 or 2 things that I looked at, you can have all the statistics you want, and only 2 meant a lot to me. 1 was, how many new patients did I have for the week? And number 2 was, what was the volume for the week? Those were the 2 things that I paid attention to. And sure, we had all kinds of other statistics and so forth, but those were the 2 that I ended up going to my front desk saying, I want to know what these 2 numbers are, and that's what they knew I was coming, so they'd have it ready for me. So let's get started, and we'll go to the first topic here. And okay. There's in-house versus out-house, and I gave this lecture 40 years ago at Parker, and everybody laughed because they were thinking of out-house, you know, because I lived in a farm community and we got accused of being the rural chiropractors. But basically what in-house and out-house means, that in-house is what you do and say in the office itself, and there's a whole thing here on what do you say to patients. It's called the table talk. Then there's the outhouse, and the outhouse just basically was, what did you do outside the office? And we're going to talk about that because that has changed. In-house is exactly the same. Outhouse has changed. So let's take a look. These terms simply refer to where the marketing and the patient interactions take place. And here's the first thing in an in-house method. During a first new patient visit, don't let the family sit in the waiting room. That's number 1 mistake that practitioners make. They'll have the CA bring the patient back while they've got 4 members of their family sitting out there. The family should come back into the adjusting room to see what you do. And I can tell you unequivocally that I got more new patients having the observers watch to see the balance of the leg lengths and what took place and how we could balance them, because you balance the patient on the table and the husband or the wife standing there said, I wonder what I'm like. And I would simply say, well, why don't we just check you? And then of course, if they were off, then they'd say, what do you think about the children? And so the one thing I found out is you have to have them observe the leg test. Well, let's be careful about that. You have to show them the short leg. Remember, they're usually shy and they won't admit they don't know what a short leg is. So have them come in close and make sure they see how far the patient is out of balance. Just here the other night, I have a friend of mine here who is a cardiovascular surgeon, and he's East Indian, and his cousin is a physician from India, and he brought him over because he had back trouble, and he wanted him to see what I did, and I used this exact technique. I had him and his wife and their son, they were all along. I brought him right into my adjusting room in my house and showed them how far his leg length was off, took it up to position number 2, and then ended up, and I told the son, take a picture of this because your father's not going to believe you anyway. So he stood there with an iPhone taking a picture of every time that we did something to balance the legs. And now his wife said, I'm having neck trouble. Can I be the next patient? It was just like shooting ducks in a barrel, as they say. So I've been doing that for 50 years, and it's just a real simple thing. Doesn't cost any money. It's just a simple way of doing it. Now, there are three things the patients ask when they get off the adjusting table, and the observers are thinking it. So let's take a look at the three things. Number one, the first question they have is, how long does it take to get well? That's number one. Number two, how often do I have to come back? Number three, how much will it cost? Those are the main three questions that they ask when they come up off the adjusting table. Let's take a look. The answer to number one is it takes 2 weeks to heal a cut and 9 months to have a baby, and you're someplace in between. That tells the patient, I don't know, I've only adjusted you one time, and I'm not a mind reader. And so just remember this, it's a simple little analogy. It takes 2 weeks to heal a cut, 9 months to have a baby, and you're someplace in between. The other thing I used to say is, how long have you had this? And the patient would say, well, I've had it for about 10 years. And here's what I would say to them. Why don't you give me 1 month for every year that you've had this? That made sense to them because they were usually chronic, and it's probably going to take some time to get this patient out of trouble. So that was a good answer for that. Now, people always ask how you schedule patients. And this isn't on the slides here, but something that just popped in my mind. When you start a brand new practice, no one seems to know how to schedule correctly. And we used to call it cluster booking. If you have 10 patients in a day, put all 10 of them in at 9 o'clock in the morning. Why? They see other people there. They see them actually in the office. And everybody wants to spend a ton of time in their office when they're brand new. It should work like this. You should be in the office Monday, Wednesday, and Friday, and Saturday morning, because you have to service people when they're not at the job. And then Tuesday, Thursday, and Saturday afternoon, you need to be out in the community. And I'll tell you what to do when you get out into the community here in just a moment. But we schedule a new patient every other day for a period of 2 weeks. And we tell them, go out to the front. What time do you get done with work? And they all get done at 4:30. Well, go out to the front and tell them you can be in the office by 5 o'clock. And so schedule every other day for 2 weeks at 5 o'clock. Now they're in a habit pattern also. And so that's why you don't want to be doing examinations. There's a hot time in the office, we call it. That's from 4 till you get done. That may be 6:30, 7 o'clock, I don't care what time. But that's when you see patients. And remember this, your practice will never get any bigger than it will be from 4 to 6 in the afternoon, or 8 to 10 in the morning, whichever works best for you. But there's a time to adjust, and then there's a time to do other things. For example, examining new patients. You never do that during your hot adjusting time. That's always done at 3 o'clock in the afternoon in Minnesota because everybody's drinking coffee, and so they're all in the store anyway, so you got plenty of time to examine that one patient that's down there being examined. So at the end of the 2 weeks, then the patient should be at least 50% better. In the old days, we had what we called a 2X clear. They came for 2 weeks, and if they weren't 50% better, we X-rayed them. Now, I just saw the other day the ACA came out with their brand new guidelines that says you shouldn't X-ray a patient for the first 6 weeks, I believe. But anyway, today, most chiropractors are not buying X-ray equipment because when you're practicing in a big city like we are here in Phoenix, they will come to you with their MRIs, they'll come to you with their PET scans, everything that's radiology. They bring them in with you to put on your computer and take a look at them. And also they bring you one really important thing. That's the report from the radiologist. So then we cut the patient down to twice a week. And when the leg length is better, we go to once a week. So it's kind of every other day for 2 weeks. Then if they're getting better, we go down to twice a week. Then we go down to once a week. That's a good schedule to start a new patient. Now, I've always been asked this, and I tried it. How about a once a month practice? Because that's what's common. When I got out, went in with my old partner, Dr. Lee, he was selling them series, and then he would have a once a month program for them. And I noticed they never came back. And the reason it doesn't work is too long in between, and patients, if they're feeling halfway better, they got busy lives. So they go about their own thing. Most maintenance patients need to be seen once per week. I remember I had a young associate that started with me in Redwood Falls, and he said one day, he said, do 100 people get up on Sunday night or Monday morning and say, I have to go to the chiropractor? Are they all programmed for that? And I don't know why it came to me, but I said, they're constitutional inadequates. In other words, they need support. And these are the people we kept out of real serious trouble because they kept as well as their bodies would allow. But once a month, forget it. Now, how much will it cost? When I first started practice, it was easy. They had a choice. They could pay on the way in or the way out. And costs vary from area to area. But the one thing I've found over the years is people that went into prepaid plans, it worked for a while. But that's all, because then people got tired of it. Your referrals go down. And so today I have a statement. I say, take all the insurance that you can take, but make the rest and make the most cash. Now, Ray Foxworth has a company called Chiro America, and I really like his plan because it's for, I think, 49 states now. Washington is one that you can't do it. But he's got this into like a little HMO that they sign up for $25 or something like that, and they pay cash to you, and it's totally legal. It's the most legal cash program I've ever seen. It's called Chiro America by Dr. Ray Foxworth. And let me tell you, that's one thing, if you're a brand new practitioner, I would get started immediately. You might sell somebody a plan, but in the end, they'll resent it. And so I just wouldn't do any plan of any kind. Now, let's talk about maintain an in-house communication center. You could have it digital today, or a bulletin board is what we used. An Activator website contains a research section with all of our abstracts on clinical trials and peer-reviewed papers. With over 150 papers, there could be a new paper up every week for almost 3 years. Let me give you an example. I had another friend here just about a month ago that developed Bell's palsy. And she called and she said, my face fell down. And I said, well, let's get it checked. And so I took a look at her, and there's a paper on Bell's palsy that we did with Activator. Basically shows if you get it immediately, the chances are really good of having them come back to normal. If they're under a certain age, it's even better. But I'm telling you, most people out in the world, most field people, most patients, they have no clue that you can take care of Bell's palsy. So I would put the Bell's palsy paper up there, and you may want to even just take the abstract and underline a couple of things because patients aren't going to read a whole paper. But make it simple so they go, oh, Bell's palsy, oh, osteoporosis. I mean, there's all kinds of different things, and we've got 150 of them up there. And I think there's probably about 60 case studies, and those are very valuable. So I would have, if you could put it up digitally, it's better, but I would have it where you could put it on a bulletin board, and everybody's nosy in an office, and if they're waiting in a waiting room, they'll walk up and they'll take a look at it. And so it'll be a good thing for you to be able to educate the patient. Now, let's go to outhouse. Some things never change. I've attended Parker seminars for over 40 years, and one of Jim Parker's standard teaching was called Whip Out a Card, WOC. I want to tell you, to this day, I still have a wallet that has a compartment for my business cards. And just today, just being out and about, I passed out 3 business cards just because I had them there. And sometimes when I'm doing a seminar, I'll ask doctors, may I see your business card? I'll bet you that it's 80% or almost 90% that do not have a business card on them. Now, here's what Jim Parker found. He used the example of the Gideons, that's a Bible study group and an evangelistic group. He said, for every 6 tracts handed out telling someone how to get saved, 1 person got saved. So I get the bright idea, I'm going to do some stats on that myself, and I'm going to see what happens. So I tried it for 1 year, a period, and every 6 card I handed out, I got 1 new patient. Well, just think about it. You're meeting people, aren't you? You know, way back years ago, I was 28 years old and I was not too smart, and I decided to run for the state senate in Minnesota. And so I door knocked 2 counties. When I got done at practice at night, I door knocked 2 counties. And I had a little card I handed out that said RN4 for state senate. And then I'd say something to them like this, because I didn't think I was going to win. I said, in case I don't win the state senate, I'd like to be your chiropractor. I swear my practice went up 32% in that 6-month period. The second thing that happened, up to 3 years later, people were still bringing RN4 for state senate cards into the office and say, oh, you remember I met you out on the campaign trail? And so it's a matter of what? Contact. Now, community events. I mean, how many spinal screenings have you done? You've heard about it, talked about it. You just have to be out in the community. Take every opportunity you can to be in front of your community. And it doesn't have to be a formal thing. You know, you can just be out, just meeting and greeting and talking to people. I mean, I fly in an airplane, and when they ask, what do you do? I say, I'm a chiropractor, and they want to be adjusted on the airplane. You don't even have to push hard. It can be just something of informational value. Take your card. And now it's very easy. For example, in the activator community, we just say, go to activator.com and hit find a doctor, and there'll be a doctor in your area. We'll talk a little bit more about that later. Years ago, when computers were just coming in, I had a friend in the turkey processing business, and he had the first IBM 36 in the state of Minnesota. I talked him into putting our mailing list on that computer. That was a big deal, a mailing list. And we were also able to communicate with our patients once a month. As a matter of fact, we had a disease of the month club. It was blood pressure in the fall. It was diabetes in the next month. It was one thing after another. We developed our own disease of the month. And now it's a little different because people are more into looking at their blood pressure at home and things like that. But back in those days, getting a blood pressure test was a big deal. And so just think about that concept, and you can make it work any way you want. Now, we're going to talk a little bit more about how things have changed. Today, technology has changed it all. We now can track our patient flow via the internet using Google Analytics. And this has always been a dream of mine, and it's taken 15 years. And I can tell you that I had more sleepless nights putting this together than any other thing that I've ever done. But when a doctor becomes proficiency rated, we put them on our doc@activator.com website. And we allow chiropractors to link to their own website. And see, doctors are a bit egotistical, if you haven't gathered that yet. And so they think their website is the only one their patients look at. Well, it is probably the only one their patients look at, but they don't have any traffic. Last month in Activator, we sent 15,000 new patients to our 2,000 Activator practitioners, and we've got the data to show it. Now, here's the interesting thing. 80% of that was new patients and new people looking, because all of a sudden Activator is synonymous with chiropractic. Now, we found through marketing research and our marketing partners that patients want to see the doctor, they want to see the staff, and they want to see the office. They don't want to just see a name. When a doctor has upgraded their doc@activator.com page and they utilize all of the features, including a full bio, photos, and so forth, we see an average of 66% more traffic monthly. Why? Because people want to see who they're going to be taking care of, who's going to take care of them. What does the doctor look like? Which leads me to another thing I totally disagree, that the doctor should get familiar with their patients. It's always Dr. Joe, Dr. this, Dr. that. There has to be still some mystery of them being a doctor. And I put down here to tell a story of the 2 gas station owners. two small towns, and they were about 40 miles from Redwood Falls. And each one of these guys were really, really into sending me new patients. You know, in the old days, we used to hand out these little thank you grams, they were called. We'd write a note, thank you, John, for sending us a patient. We're taking good care of him. And so I started giving these out, and I noticed that they were really in competition almost. They were just really going at it. So then, of course, I got them into competition. And they thought it was just a blast because everybody that stopped in, they'd tell them what the great chiropractor in Redwood Falls was. And so each one of them, in a period of about a month or two, sent 100 and some patients. And it was just wild because I told them at the end of the contest, I'm going to take whoever wins golfing into Wednesday night men's night at the country club. Now, I knew there was one of those guys that was really a great golfer. So I took him to the country club. We went out and played golf. I let him win. He watched me three-putt at several greens. And I guess it's the mystery wore off. He came into the club. We had drinks together and everything like that. And I thought, boy, he's going to be sending me new patients like crazy. He never sent me another new patient the rest of the time that I practiced there. Why? I think it was because he got to know me. And I think there's a big thing here about having a mystery of being a doctor. So I think familiarity breeds contempt. Also, patients want their doctor to be well-dressed, professional, and look at the last word. It's called normal. They're just looking for somebody that's not a kook. And, you know, I know there are fashion trends that happen, but you want to dress professionally. And if it goes from a shirt and tie down to scrubs, that's okay because that's considered normal. So I think it's really an important thing for doctors to look, act, and be professional. Don't get too close to those patients. It's fine to be friendly. I'm not talking about that. But I'm just talking about going out and being social with those patients. That's when you lose that doctor-patient relationship. Now, we're about 20 minutes into this, and that's exactly what I like to keep them at. So if anybody has any questions, I will be happy to answer any. And it's on questions and answers. And if you have any questions and answers, we've got 300 people out there. And so I'm sure there's a couple of people that have some questions for us. We'll take a look here. Here's somebody that says, it would be really nice if we could post testimonial videos on the Activator website too. You know, we have all kinds of requests, and to keep a website just functioning, I'm afraid that would just open it up too much. We try to get as much of the things we can get up there, but it's an idea. So I'm not rejecting it. Let me think about that. And it might be a place for it that we could actually put it out, and it might be good. And here's another question down here I can see. Okay. Here's somebody raised their hand. Okay, here's a question that's from Joe English, and he says, what about using social media? Well, there's Facebook, there's Snapchat, there's, trying to think of a couple of the other ones. Instagram, MeWe, there's a bunch of them because Facebook kind of got a bad name out there. And so I'd say let me give you an example. I have 6,000 followers on Facebook. These are not patients, but they're most of them are doctors. And I try an experiment because I had been wishing people happy birthdays. And I got a couple answers back from doctors out there that said, you were the only one that wished me a happy birthday. That was just a chilling thing to me, that not even their family had wished them a happy birthday. So I said to my wife, I am going to purpose myself when I get up in the morning before I open up my email or anything like that. I'm just going to wish everybody that are friends of mine on Facebook a happy birthday. Now, here's how people respond. This is what social media does. My birthday is September 2nd, and last year on September 2nd, I had 3,000 well wishes for my birthday. And I know that people are looking at it. I know people are paying attention to it. And so I think that, yes, social media, and I would go with Facebook right now. I still think it's the most popular because you can communicate back and forth so much. Here's a question Ted Marriott asked is, can we post a short video of the office on the Activator website? I've got my IT person sitting right here. Can we do that?
Absolutely. Sorry, hang on. Let me get closer. So to post a short video of your office on the Activator website, that would require a premium subscription. And all you would need to do is upload the video of your office to YouTube, and then we would go into your premium subscription and change the video from the patient orientation video over to the video of the office.
I've got another question up here. What does a new patient workup look like in your office? Well, you know, all you hear us teach is Activator, but we go right through the regular, well, number one is the case history. And I think you probably know this, that almost 80% of your diagnosis comes from your case history. And so even all the years that I practiced and had associates, and I had 25 of them, I never let them do the history, because that's where you bond with the patient, and that's where you find out what's wrong with the patient. And students coming out of school are the worst because they've been pent up for 4 years learning things. So now they want to regurgitate it back on a patient who doesn't give a damn. And so we start with the history. That's the number one thing. Then go to orthopedic, neurological, if that's required, and it's not in every patient. And then from that, we go to our analysis and so forth that we do in the Activator world. And from then on, it's all record keeping. And I was the first one, by the way, long before digital record keeping came. I had I developed a thing called a thrust report. And we had it on a one page. You could open it up and look at it, and it would hold about 12 office calls. But you could see the patterns of the patients getting well. And you could look and see if they had a low back, how other things in the body would start to be gone. And I would tell the patients, now, every time you see a check mark, that means you got a problem. But notice when the check marks start leading and they'd say, oh yeah, my head is better, my neck is better, I still have something in the low back. And I'd say, yep, that's exactly what we're still working on. And it worked out extremely well. So, got another one down here.
Just want a reminder that this will be available as a replay on YouTube tomorrow morning, and you will receive an email with the link.
Okay, another hand went up here, and I see it, but I don't see the question. Let's take a look. It's somebody here that had trouble loading their computer, and we have not had any trouble at all. And but I think Kevin told you there where it's going to be posted. And we just asked somebody else here what was the question. Ted Marriott had his hand raised, but didn't ask a question. So we'll wait just a minute here for Ted to ask the question he was interested in. And anybody else, if you have anything right now, just type it in, because we're going to close this off here at 6:30. And okay, here's, he says, Activator seems to work great with muscle testing too. Well, you know, I am old enough to be with George Goodhart, who started kinesiology testing in the chiropractic world, and then went to David Walther, who wrote textbooks on it. And yes, there's a lot of things there. Now, a lot of these things have not been documented. And that's the big problem. You have to have the documentation. For example, somebody was criticizing us today on Facebook about Activator only having leg testing and isolation testing and so forth. Well, we're the only technique that has 26 clinical trials, 150 peer-reviewed papers, and we have the 2 papers that are validated on the leg testing versus finding it by palpation, because palpation is like the kappa coefficient is 28.28, and the other one is then somebody says, well, I'm a motion palpator. Well, that's fine. That's a 0.47. Activator's got a 0.72. So do we have data? Yes. And I have a statement that says, data always wins. And just remember that. When you go to court, data will win. When you're in a lawsuit, data will win. When you're explaining it, and I got another new patient down here, a question from somebody that says, how do you explain Activator to a new patient? You should have tried to explain it to him 50 years ago when I was the only one doing Activator. They would come in and someone would just flat say, I want to get my neck cracked today. And I would say to them, well, if you want to do that, I'll send you down to a doctor here in town that's really good at cracking necks. We use a scientific adjustment here called an Activator adjusting instrument. And I never lost a patient. And so I had a guy here that was in Hawaii with us this winter when Jim Cox and I put a seminar on together. And he called me and said, how do I introduce Activator into a clinic? I got enough patients. But he said, I'm killing myself. How do I introduce it? And I said, well, you got 2 ways. You can take the new patients that are coming in and introduce it, and the rest of the practice is not affected. Or you can walk in and say, look, I want to be able to be your doctor, but I'm not going to physically be able to handle it. And so if you want me to be your doctor, then I guess this is going to be the technique that I'm going to use. So then we say that we use a high-speed piece of equipment. You won't feel any pain, and they're always very happy about that, because 90% of people don't go to a chiropractor because they don't want to get their neck cracked. And just this afternoon, I had to go to the dermatologist here in Phoenix with the sun. And he said, the only reason I have never been to a chiropractor is because I don't want my neck cracked. And I said, well, I gave him a card and said, go to activator.com, find a doctor. And I said, you'll find somebody in your area and you will not get your neck cracked. So he was excited about that because he had some problems. Well, I'm really happy that we got the questions that we did tonight. And here's another question down here. It says, what's the best way to send in Activator tests to Activator Method that are not in the book that work? We're always interested. If you've got tests out there that you've been using over and over and over again, we have a committee here that takes your tests, because there is one danger that's called the clinician's trap. You adjust somebody with your brand new test and their headache goes away, so now you've got a brand new cure for headaches. Well, it has to get tested. But the way to do it is send it to me, awfuhr@activator.com. And I assure you that I will take a look at it myself. And then the next thing I'll do is farm it off to our curriculum committee. And we've got 10 people there that will be very happy to run it. Last year, we had a doctor in Illinois came up with a new way to adjust sacrum. And it was absolutely gangbusters. And so you just never know, because people are out in the field. And by the way, the second textbook that we had, about half of the things that were in there were not mine. They were people in the field that found things that worked. They sent them in. We edited it and put it in the book. And that's why out in the field is the way to look at it. So yes, Ted, just send it in, and we'll be glad to farm it out to the committee. But send it to me personally, awfuhr@activator.com. Well, I want to thank all of you for taking your time tonight. Those of you that were not able to spend the time, just simply go to the website and you can check in on that. And we'll be looking for next month, and we'll have another hot topic. Thank you.